Ukraine, a post-Soviet country located on the crossroads between European Union and Russia. Since its independence in 1991, following the dissolution of USSR, Ukraine's population has shrunk by at least 7 million, and the country still struggles to reshape itself. This is a country where the poor get poorer and the rich get richer, with a wide socio-economical gradient and erosion of the middle income class. Ukraine today is a lower middle income country with a legally defined low minimum wage of 110 euros per month. Issues like effective governance, economic and social reforms, and civil liberties are all on the agenda. Despite status and income differences, they all share the same problem. It's their health. Today, Ukraine struggles to combat major communicable disease threats, as well as new challenges posed by non-communicable diseases and mental health. The country is at the epicenter of HIV infection in Europe. TB incidence continues to be high with an increasing burden of MDR-TB. Immunization coverage is dangerously low. Ukraine continues to confront the legacy of the Chernobyl nuclear accident in 1986. But today, non-communicable diseases comprise the bulk of mortality in Ukraine. The people of Ukraine today have the highest burden of circulatory system diseases in the region. Tobacco, alcohol, unhealthy diet, stress and physical inactivity are only some of the determinants. The poor state of health system in Ukraine is partly to blame. In case of NCDs, the key problems lie in the primary health care, where most of the medical professionals in the country are overloaded with work. According to the Ukrainian constitution, the state creates conditions for effective medical services accessible to all citizens. In reality, universal health care and access to quality health services are limited. Out-of-pocket payments are high. Ukraine's health system is inefficient, with a predominance of hospital-based services that are not well connected with each other and mainly focused on curative services, with poor continuity of care. The financial crisis has made things worse. Another problem which affects doctors and patients is fragmented health system in Ukraine, where too many entities are involved in management. It is not surprising that Ukrainians are the only ones in the WHO European region who voted for better healthcare and healthy lifestyle as the first priority for the post-2015 agenda, the world we want 2015. Together with WHO support, the presidential administration is steering the actions needed through the implementation of the presidential program on economic and social reform. The Ministry of Health is keen on improving its health system functions and tackling different health issues. It is aiming at using the overarching policy tools of the WHO European Region Health 2020. Through the European Health Policy Health 2020, the Ukrainian dimension, as a platform for making the needed healthcare reforms. The plan includes the most advanced practices of WHO for reducing risk factors for NCDs, such as measures of taxation and regulation of marketing to reduce levels of alcohol and tobacco, measures to reduce salt intake and removal trans fats from the food.
And here we work very closely in policy making, in following the idea that it's not enough to come and explain people how to live. The state has to provide the conditions and has to provide the right conditions from early childhood to adult. And that NCDs, non-communicable diseases, are not the individual problem always, that everybody needs to join hands into this fight.
I think this is a breakthrough, a real breakthrough that shows also the leadership of the UN and WHO in bringing together a constituency and rallying it around a very important political theme and concept. And this is the second time I understand that this happens beyond the HIV/AIDS. So for us it's very important and will give us a platform where all of us, we can work together, the UN and civil society and some of the governments, of course, who will embrace the agenda.
A good example of successful cross-sector collaboration, led by WHO, is implementation of the Framework Convention on Tobacco Control and the full smoking ban in public places, which was introduced in Ukraine in December 2012. Hanna Hopko, public activist, fought for 7 years to introduce the smoking ban. She finally can invite her friends with kids to the restaurant. It is now safe since all public places are smoke-free. Her friend Marichka is a TV presenter who supported the movement along with other people. It was a synergy of public efforts and government negotiations and WHO support that made success.
Україна, слава Богу, залишила топ-5 країн з найвищими показниками поширеності тютюнокуріння. І ця тенденція, що українці відмовляються від куріння і також знижується куріння серед підлітків, вона потребує закріплення цього успіху. Тобто ми зараз активно працюємо над тим, щоб успішно ухвалені антитютюнові закони працювали. В даному випадку тут дитина саме таким продуманим.
But despite this success, there are still dangers. In the past, the Ukrainian government has challenged plain packaging legislation at the WTO. Ukraine, like many countries, still does not have a whole-of-government approach to fighting big tobacco. Oleg Shvets, head of the State Research Center of Nutrition Hygiene, advocates the need to change the quality of citizens' food baskets. He thinks that only tailor-made state policies can make change, and there are realistic goals to start with.
Головні три направлення щодо якості продуктів і взагалі харчування людей – це вплив на агресивну маркетингову політику виробників нездорових продуктів харчування, це обмеження споживання солі різними шляхами і це заміна трансжирів в складі продуктів харчування на інші жири, які менш шкідливі.
Dr. Shvets is not the only one. Otto Stoika is also a very unusual doctor in Ukraine. He walks to and from work and carries a backpack. His job is to promote a healthy lifestyle among general public, and he dreams to transform a healthy lifestyle advice to a formal prescription that people will get from doctors. And he is using WHO guidelines in the daily work.
У нас, можна сказати, такий стратегічний орієнтир – це все ж таки на документи і на питання, які висвітлює Всесвітня організація охорони здоров'я. В першу чергу. Тому що в нас, ну, скажімо, на рівні міністерства все ж таки, ну, скажімо, ще стратегічної такої лінії профілактичної я не бачу.
A perfect example of such prescription is Igor Didik, whose physical exercises and calories are planned carefully and kept strictly, since he has diabetes. Igor's work with diabetic associations have had a real impact on helping people live with the disease by organizing sport events and supporting them psychologically.
То есть государство помогает финансово, помогает там врачами, да, инсулинами, но вот общественные институты, они должны быть.
Working with advocates and activists is only one of many elements of WHO's everyday work in Ukraine. WHO is supporting the policy dialogue towards universal health coverage, involving all the main players in health system, working to ensure that healthcare for NCDs is dealt with in the context of strengthening the overall health system. This includes training, health resources, access to essential medicines and technologies, standards for primary healthcare, and referral mechanisms. The WHO office is tailoring global norms, standards, and resolutions to the specific context of Ukraine. Special attention is given to the inclusion of invisible people, such as Roma and migrants.
You see me here, one here. I'm not alone. We have a country office here, but they are not alone. The country office here is supported by the focal points in Ukraine, Ukrainian experts. We have consultants within Ukraine that are working with us. But more than that, between all of us, shoulder to shoulder and in front of us, leading us are our headquarters with our Director General, our regional office with our regional director. So all in all, we get hundreds and thousands of experts, worldwide and world-renowned experts with us here with you talking today. We are just the feet, the hands, and the mouth.
UN and WHO globally, and country office locally, work closely with partners to define new and emerging goals, tailoring them to the specific needs of the country and closely monitoring the progress. A successful such long-term partnership in Ukraine is with the Swiss Development Agency, which has provided support for the past 16 years for the implementation of health projects, particularly in the area of mother and child health. The new challenge for the partners are NCDs.
We see that the issue of NCD has been recognized by many players, including the Ministry of Health, as a key issue for Ukraine. NCDs are maybe a new issue for Ukraine, but not for the world. They are being tackled, partly also jointly, by WHO and our agency in other countries. So we are sure that the experience of WHO will help a lot also in this policy dialogue.
The logic of the project fully demonstrates the approach of WHO. It is based on a political declaration of the high-level meeting of the UN General Assembly on the prevention and control of NCDs and the WHO Action Plan. However, it is carefully designed to address local needs.
I hope that we will succeed by tackling the 4 entry points. And this entry point, each one of them is a world of its own. And the first one is, I'll start with the first one that is basic, it's the health intelligence.
Health intelligence is a comprehensive information system which follows a person from cradle to death. Integrated primary healthcare, where physicians provide patients with a wide range of health-focused services, including preventive work. Health governance, where the responsible state provides legislation and actions to improve lives. It is also ensuring universal health coverage and access to quality health services. Health promotion, where a healthy lifestyle is accessible for every community or school. Altogether, those 4 will create conditions for better health, including mental health, and reducing the burden of NCDs.
This project is long. We are planning it with SDC in 2 phases. The first phase is inception phase, which we are now starting, and this is going to last for 1 year. And the second 2 stages are going to be 4 and 4 each. That means that in 9 years when we meet here, I hope that we will all be healthier and happier.